Okay, students. Now going to discuss about disorders of circulatory system. Disorders of circulatory system. There are four types of the disorders. This first one is hypertension. Hypertension. Okay. What is the meaning of the blood pressure? Blood pressure. Hypertension means high blood pressure by the blood vessels. Okay. What is the meaning of the blood pressure? Blood pressure, that means pressure exerted by the blood on against the wall of the arteries is called blood pressure. Okay, and it is normally equal to 120 by 80 mmHg. Okay, upper one indicates systolic pressure and lower one 80 mmHg indicates diastolic pressure. Okay, hypertension means high blood pressure. High blood pressure, that is equal to 140 by 90 mmHg. 140 by 90 mmHg. 140 by 90 mmHg. In this, 140 is systolic pressure. Systolic blood pressure. Okay, systolic blood pressure means the blood pressure, the pressure of the blood exerted at the time of the heart chambers goes to the contraction. Heart pumps the blood into the arteries. At that time the blood pressure is called systolic pressure, that is equal to 140 mmHg. 90 mmHg is the diastolic pressure. It is the blood pressure when the heart goes to the diastolic condition, rest condition. Okay, that is called diastolic pressure. Hypertension means high BP, that is equal to 140 by 90 mmHg. Blood pressure is identified with sphygmomanometer and it has no symptoms. Any type of the symptoms are not appeared in this disorder. And causes, what are the causes? Nervous tension. Nervous tension is the one of the cause, and emotional stress, anxiety. Okay, emotional stress is also one of the cause, and it leads to the heart failure. Okay, prolonged hypertension causes the heart failure and heart stroke. And another one is the kidney failure. Okay, and next one is coronary artery disease. Coronary artery disease. What about coronary artery disease? Already you know coronary arteries. Coronary arteries that supplies the blood. That supplies the blood to the muscles of heart. Heart supplies the blood to the heart muscles of the heart by the coronary arteries. Okay, students. Next, in this example, for example, this is the coronary artery. Coronary artery. In this coronary artery, this is the lumen. This is called lumen. Okay, students. And in this lumen, the blood is flows. In this region, any one of the region, the accumulation starts. Deposition starts. Okay, by the calcium and the fats, cholesterol, fibrous tissue. These are the substances is accumulated in this region. Okay. And sufficient amount of the blood is not supplied to the outside. Okay, not receive oxygenated blood, nutrient rich blood is not goes to the outside. Okay, and oxygenated blood and nutrient rich blood is low. Okay, and adequate amount of the oxygenated and nutrient rich blood is not supplied to the heart muscles, okay, myocardial cells, okay. This is the condition goes to the ischemia. Ischemia means reduces the oxygen, okay, reduces the oxygen levels to the body cells, okay. Sufficient amount of the oxygen is not supplied to the body cells by blood is called ischemia, okay. And it also leads to the chance of the myocardial infarction means localized death of the cardiac muscle cells, heart muscle cells. Muscle cells of the heart goes to the death, that is called myocardial infarction or heart attack. Okay, students. So, coronary artery disease leads to the ischemia and also causes the myocardial infarction or heart attack. And other factors that causes the coronary artery disease for smoking, diabetes, high BP and lack of the exercise and the stress. These are another some amount of the factors which cause coronary artery disease. And angina pectoris. Angina pectoris. What is the meaning of the angina pectoris? Angina pectoris, that means pain in chest region. And it is most common in adult people above the age of the 45 years. Okay, and it is symptomized with narrowing the blood vessel. Lumen of the blood vessel that is becomes into narrow, okay, and reduces blood supplies to the heart, okay. Heart cannot receive sufficient amount of the blood because of narrowing the blood vessel, okay, such as arteries. And causes for angina pectoris is smoking and diabetes and the high cholesterol present in the blood and high blood pressure, hypertension. These are the causes. And another fourth one is heart failure. What is about the heart failure? This is the heart failure also called congestive heart failure. Why it is called congestive heart failure? Because of congestion occurs in the lungs region. Congestion present in the lungs. Okay. Next, another, in this type of the disorder, sufficient amount of the blood is not supplied to the body parts, not received by the body parts, okay. And it is the one of the symptom. And causes are coronary artery disease and high blood pressure and another one is the diabetes. Okay, these are the causes for heart failure. If you observe, coronary artery disease leads to ischemia, myocardial infarction or a heart attack. Necrosis occurs in the myocardial infarction. Necrosis means localized death of the cells in the body is called necrosis. Okay. Ischemia, myocardial infarction, heart attack, these are appeared in coronary artery disease. Okay, and under ischemia is present in angina pectoris. It is not goes to the stage of the myocardial infarction. And another heart failure in this coronary artery disease also one of the cause for the heart failure. Okay students, this is an account. This is an account on the disorders of circulatory system.